Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
Above water, don't let me drown. It gets harder, I'll meet you there at the altar as I fall down to my knees. Don't let me drown.
And welcome back to Life Unrehearsed. My name is Matt Dellavecchio, specializing in life transitions, home care, and the senior living industry.
Hi, my name is Corrie, a clinical social worker and author of Someone Died, Now What? We are talking with some technology challenges, but there's all kinds of interesting things going on as we have navigated the whole moving forward in our world. And I know, Matt, you were talking to me about a friend of yours, in fact, that was doing some kind of virtual testing? Is that what it was called?
You know, travel has increased quite a bit, and if you are going to the States and other countries, you do have to get at least now some antigen rapid testing. And so I would figure, okay, you've got to make your reservation, go to one of those test centers, get your antigen test, and hopefully you'll get results quite quickly. And now many people are actually doing it from the comfort of their own home, getting their tests, which I thought was quite interesting. Didn't you hear about that? And apparently it is quite popular. And in fact, virtual testing and monitoring made one of the top trends for healthcare. And so, you know, advancements in technology, particularly in the healthcare sector, are making a difference in the lives of many patients. The 2022 Top Trends Shaping the Future of Healthcare was recently released with some encouraging and very interesting findings. And to talk more about it, we have on the line Kristen Moulton. Kristen's the Manager Program Development, Medical Devices and Clinical Intervention with an organization called Canadian Agency for Drugs and Technology in Health, also known as CADDIS, and they released this report about some of the top trends. Kristen, welcome back to Life Unrehearsed.
Hi, how are you today?
Doing well, Kristen. Thanks for doing this here on a Saturday. First of all, just to back it up a little bit, what is the Canadian Agency for Drugs and Technologies in Health?
So CADDIS, and I thank you for having me last year because now my mom does know what I do. So we are a pan-Canadian drug and health technology assessment agency. We provide evidence and advice as well as recommendations to healthcare decision makers about the use of drugs, medical devices, and other health technologies. So we do things like evaluate evidence for health technology. Is it effective? Does it bring value to patients in the healthcare system? And we also scan the horizons for emerging technologies and trends, just to help decision makers keep pace with technological change. We're not for profit, and so we're funded by the federal, provincial, and territorial governments, except for in Quebec. And there is a similar organization here in Quebec called Lianas, and we work closely with them.
So, Kristen, you mentioned something about bringing value to Canadians, and I'd love to explore that a little bit more. Can you expand on that? Can you give me some examples of how you bring value to Canadians?
Yeah, so you or I probably wouldn't buy a new car or a new fridge or some big ticket item without doing some research first, right? We'd want to find out how a product performs, how much it costs, and we'd probably want to read some reviews before making such a big purchase. And so decision makers in our healthcare systems, they need to know the same type of information before they fund or before they purchase a new health technology. So the staff at CADDIS are experts at finding and evaluating the best available scientific evidence about drugs and other health technologies, and then delivering that evidence to decision makers in a way that they can understand it and use them. And so health technologies are a cornerstone of our healthcare system, and they'll be playing a role in pandemic recovery. So when it comes down to health technology, it's really important to help our health systems understand and anticipate what is coming down the pipe in terms of innovation.
Listening to Life Unrehearsed with Matt and Corrie, and we're talking about the top trends shaping the future of healthcare in Canada with Kristen Moulton. All right, Kristen, let's get right into this. As mentioned, CADDIS was responsible for the recent publication of the 2022 Top Trends Shaping the Future of Healthcare in Canada. And I'd like to start with remote diagnostics and monitoring and care management. That was at the top of the list. Can you explain that?
Yeah, so remote patient monitoring was available in many places before COVID, but really the pandemic accelerated the uptake. So remote monitoring and remote care offered a way to deliver healthcare and keep both patients and healthcare providers safer with respect to potential COVID transmission. So some of it has been a part of our lives for some time, like the phone service that I know I relied a lot on when I had little babies, wondering, do I need to pack up and take my little baby to the emergency department late at night? Or can I wait and get an appointment tomorrow? So at its core, remote monitoring and remote care relies on the use of communication technology to share health information between patients and between healthcare providers. And so example of that kind of information that would be shared would be things like oxygen saturation levels or cardiac rhythm, or a person's own observations about their own mental status or medication intake. So for example, for people with high blood pressure, readings can be shared with care providers to try to figure out whether a medication is being taken, and then in turn whether that medication is working. And it can be used for a lot of different things. So there are devices that can be used in the home, such as a digital otoscope, which is that thing that you use to look in ears, and a stethoscope that can share information to a healthcare provider that's doing a video appointment, like just in real time. You have it in your house, and the healthcare provider can get the real-time readings through an app. So it could help diagnose an ear infection or figure out if a person is breathing normally in that kind of environment. Or I know sometimes something in the pipeline that I find particularly interesting are devices that may be able to help identify Alzheimer's disease or dementia by identifying changes in the way people move or changes in the way people talk, because we all have patterns in our speech and movement. So those changes, those remote tools, might be able to see those early changes and flag to healthcare providers and people experiencing the changes that there might be something going on. And no one is really, no one's trying to remove that face-to-face healthcare interaction.
Right.
But we all know that for more chronic conditions like chronic heart failure, there can be a lot of healthcare interactions, and that can be difficult to manage when it comes to arranging transportation or convenient appointment times. So getting that coordination right can be challenging. So what the health system is looking to do now with some of the new technologies is to find that balance, have the face-to-face appointment when it's needed, and then have that remote interaction when it's not.
We have to probably go quickly to a traffic break, but I just wanted to know another trend you mentioned that I understand is point-of-care testing, and I believe that has to do with rapid tests, as an example. Can you sort of quickly tell us more about this trend?
Yeah, so point-of-care rapid tests are a great example because most of us are quite familiar with that right now. So it's not new. It's testing for something where the sample collection and the analysis and sort of that science magic happens somewhere other than the lab. But these tests tend to be quicker and more convenient for the person being tested, as well as less costly than lab-based alternatives. And I think last year I talked about COVID tests being just about to make that jump from being lab-based into, the point of care. And now for some of us, that's the only kind of test we can access. Other than COVID, though, there are many emerging tests that aim to make diagnosis and management more convenient and less burdensome for the person taking the test and their caregivers. So a great example is a point-of-care HIV test that requires just a finger prick of blood and may provide results in about a minute, rather than that vial of blood and the long, stressful wait for the results.
So many things, Kristen. And we really want to get to there's many other trends that we want to talk about. We do have to head out to traffic, and we're talking with Kristen Moulton about the top trends shaping the future of healthcare in Canada. We're going to hear a few more of those, including portable dialysis machines. Very interesting, where, to get dialysis, you have to go to the hospital. And there has been tremendous headway made with these types of machines. We're here with Corrie Sirota, and we're talking about the top trends shaping the future of healthcare in Canada with Kristen Moulton. She's with an organization called Canadian Agency for Drugs and Technology in Health, and they just released the 2022 top trends shaping the future of healthcare. Kristen, welcome back. We are going to go into rapid fire mode, Kristen, because we've got a lot to cover in a short period of time. We're going to continue with some of these trends. I was quite surprised to hear about these portable dialysis machines. Can you tell us more?
Sure, that's a great question. And dialysis is an hours-long procedure where people are generally sitting and receiving fluid exchange, among other things, for several hours. So if you add the time spent getting to a clinic that provides dialysis, this has a large impact on a person and to caregivers' lives. So they may not be able to travel to a loved one's wedding or go on vacation because it interferes with dialysis, or it may be a challenge to even get to a dialysis clinic regularly due to living in a remote area. So home-based dialysis machines are not new, but the portable dialysis machines made our list because of the advances in the newer generation of these devices. So they're smaller and they're more mobile and less intrusive for those who are using dialysis. So they take up less space in a person's home, and which may make home feel a little less medical. And they can bring much more flexibility to people who may do home-based dialysis, as well as more independence. A smaller profile of the machine may allow people who do home dialysis the option of traveling a little further from home than they used to. They also have newer features like variable flow rates. So, for example, one system that might be coming down the pipeline can customize to do either a full dialysis treatment quite a bit faster, so reducing the number of times a person may need to use it per week, or a slower rate for those who find that more frequent and sort of gentler dialysis sessions fit with their lives and their comfort a little bit better.
That's fantastic. These could be like game-changing opportunities for people on dialysis. What about voice technology?
So the concept of voice technology is not new, and maybe on top of dating myself, I'm sort of revealing my inner geek, but we've seen the concept of voice technology on TV since the Star Trek days, and probably before, but in more current days, Siri and Alexa are great examples of using voice technology in everyday life. So voice technology can mean many things in healthcare, though, and it has the potential to be used in a healthcare setting or at home for healthcare use. It can be a technology that lets a computer understand what humans say and allow the computer to speak back. And so when you think of the day-to-day work of a doctor or a nurse, documentation is a huge part of their day. So voice recognition is one tool that might be able to help alleviate some of that workload by helping with documentation or calling up a file or reading a file to a person. And certainly there is more to understand and learn about voice technology. But for example, with the right health app or a connection to a healthcare provider, voice technologies could help people at home connect with the right tool or the right person for their healthcare needs right at home by talking to a digital assistant like Alexa, and saying what kind of problem they're experiencing, like a racing heart, or that they've fallen down. And it's also sort of an example about how most of these digital technologies, like voice technologies, remote care, healthcare apps, and artificial intelligence, they're all sort of interconnected and linked and working together to try to help make healthcare more accessible.
Listen to Life Unrehearsed with Matt and Corrie, and that's Kristen Moulton, who's talking about the top trends shaping the future of healthcare. Kristen, we're going to continue along with a couple of quick ones. You mentioned health apps. I'm very intrigued about this because health apps and wearable technologies are coming rapidly. The advancements are incredible. Tell us about some of those advancements.
Yeah, so this is sort of a new frontier for health technologies, and almost all of us are really not all that far from our smartphones or our other portable devices. So health apps and wearable technologies take advantage of that computer and communication power that we have with us almost all the time. So they can offer a variety of options to support the health and well-being of people. But the growth of these apps has really exploded over the past several years, but the usefulness and quality of those apps really, really vary. So certainly mental health is one area where those health apps have become really popular. They can add, they can offer self-guided interventions, which are quite accessible. But another example where the device itself is one that many people already have is that Fitbit just got an approval by the FDA in the United States to add an algorithm for detecting atrial fibrillation, which is a heart condition where your heartbeat is irregular, and that can lead to blood clots and may increase the risk of stroke by about 5 times. So the use of a health app like that in combination with remote care has a lot of potential for the use and the care of people with heart conditions. But the use of the apps often sort of outpaces what we know about their effectiveness. So not very many have been reviewed or authorized by Health Canada and are easily available in the app stores. So it might not always be clear to the user whether or not the app is truly helpful for health monitoring.
Right. So these are things definitely to look forward to. I work with teens in the summer, and some of them come on with different kinds of health conditions, including diabetes, for example. So I know that there's all kinds of things that they have come on with, but I'm looking at some of the trends. And what about this closed loop, the insulin pumps?
Yeah, so this is a really exciting area. People who live with diabetes and people who provide caregiving for people living with diabetes do a lot of monitoring and interacting with glucose levels and insulin levels. And many of us might be familiar with some of the advances in the last few decades that have allowed some people to switch from sort of those daily injections to an automated insulin pump, or from fingerprints to flashing your cell phone up against the device to monitor glucose levels. So diabetes management has changed a lot in the last few decades and continues to advance. So closed-loop insulin pumps aim to improve the quality of life of both those living with diabetes and their caregivers by kind of offering a greater flexibility when it comes to diabetes management. So you have both that insulin pump and that continuous glucose monitor, which are now able to talk to each other using sensors and computer programs so that they can help each other determine what the insulin levels are, what the glucose balance is in a person. And so these systems are designed to help keep those blood glucose levels within a certain range. And they include features such as alarms, which can alert people, someone like a caregiver, on their cell phone, even if they're not with the person. Which might help both the person using the system and the caregiver feel a little more confident that things are okay.
It's amazing,
and,
Kristen. It's just amazing how
but
it's amazing what we have to go through with diabetes and how technology is helping a lot and more down the road. There are so many other trends that you talk about in this report, Kristen. First of all, we want to thank you. And how can people find out a little bit more about the top trends?
Yeah, so to look at our trends list, you can either visit techtrends.caddis.ca, or you can just visit our website, caddth.ca, and look for our technology trends. And it's all listed there. We have a microsite as well as the full report that you can look at.
All right. Okay, Kristen, thank you so much for joining us again, and we look forward to next year's top trends as well.
Thank you so much for having me today. I love sharing the great work at CADDIS.
Thank you very much. Corrie, what do we have next week?
Recently had gastric bypass surgery. So join us to hear all about the pre-surgery process and the post-surgery experience, and the growing popularity of mobile services, including mobile dental hygiene services. They're wonderful services, including Meals on Wheels, that we're going to be sharing with you next week.
Yeah, looking forward to that. Well, thank you very much for tuning in to Life Unrehearsed.